state of our state is strong, and the state of our budget, well, it's outstanding. We are working and winning for Wisconsin.
Governor Scott Walker delivering his state budget address to the legislature just a few hours ago. We're learning more tonight about what's in that budget and how it could affect you. Hello, everyone. Thanks for joining us tonight for News 3 at 6. From schools to roads, lawmakers say they'll take a closer look at the budget plans that were rolled out today by the governor.
We have team coverage of the plan tonight. We start with political reporter Jess Garb live at the state capitol with some of the major points to this plan. Jess?
Yeah, the governor spent the last few weeks going across the state rolling out a piece of this, like new funding for the UW and for schools. Tonight, we're learning more about some of the contingencies that are attached to that new money and his plans for things like health care and roads in Wisconsin. The governor presenting his budget to the legislature this afternoon in about a half-hour address to the Senate and Assembly. He touted what he's calling the reform dividend, which he says is what's allowing him to put new money into programs. Here's what we know about what he's proposing. Tax cuts under Walker's budget total $592 million. That includes an income tax cut for the median family of four that would total $139 over 2 years. As announced before the budget, he would send $650 million in new money to public schools, but there's a string attached that wasn't announced before. It would require schools to be compliant with Act 10. In other words, require teachers to pay 12% toward their health insurance. It would also make insurance changes for state employees, moving them to a self-insurance plan. The governor says that could save $60 to $120 million, but consultant reports say it could save only $40 million or cost taxpayers $100 million. As for state highways, Walker's budget would finish Verona Road and I-3990 on time, shift part of gas tax revenues from a gas inspection program to the transportation fund, and repeal the prevailing wage for construction projects.
This budget includes historic investments in our priorities. We're putting more money into public education than ever before, making college even more affordable, caring for the truly needy, building a stronger infrastructure, rewarding work, and cutting taxes to the lowest point in decades.
Transportation's the elephant in the room. And as you know, many of the people in the Assembly have a different idea of what needs to be done than in the Senate. So that's going to be a challenge.
We cannot continue to kick the can down the road and have roads that are falling apart because it's hurting our economy.
As you heard there, lawmakers still have major concerns about how transportation is going to be handled in this budget. That and the self-insurance plan are really drawing some of the most concern that we're hearing from lawmakers about this tonight. There's also been a big question that's hanging over this. How is it all paid for? Lawmakers tell us they will consult the State Fiscal Bureau, the fiscal experts really in Wisconsin, about whether that money is really there and how much they may have going forward. The co-chairs of the Finance Committee saying this is a solid starting point, but they do intend to make changes. That'll
be interesting to see where it goes from here. Jess Garb reporting live tonight.
Thank you, Jess. That school funding issue could have a big impact on Madison schools, and our Valina Jones is live at the Madison School District tonight. Valina?
Well, that's right, Susan. That Act 10 compliance issue would specifically affect the Madison Metropolitan School District because currently their employees do not pay 12% for health insurance. Now, under the governor's proposal, schools would have to comply with provisions established in Act 10 that require employees to pay 12% of their health care premiums to receive funding. Employees in the Madison Metropolitan School District currently pay for 1.5% to 5% of insurance costs. This would raise their costs to an additional 10% in some cases, something the district has concerns about.
Well, I don't know the rationale behind a specific required employee premium contribution, but we feel as though we've been very efficient and very effective in managing healthcare costs.
An increase in aid would add an additional $11 million per school district in the next 2 years. The district says the funding would help offset cost and help provide services to students. The proposal would increase student funding by $200 per student. If approved, it would increase the state's share of education costs to almost 67%, which would be the highest level since 2009. Now, we also reached out to the teachers union, who did not respond for comment. The Department of Public Instruction would make the final determination of how districts would certify this compliance.
All right, Valina Jones, downtown Madison. Valina, thank you.